Hello. Miss Smith, is it?
It is.
I'm Henry Gibson. I'm the medical doctor on duty today. Now, I understand that your doctor has asked us to see you because you've got a rash on your legs. Is that right?
Yeah.
Could you just tell me what's actually happened, please?
I've been feeling a bit sick, just generally sniffly and unwell.
Yeah.
And then this rash started to occur.
Right. Whereabouts has the rash actually developed?
On my legs and then on the undersides of my arms.
Right.
And also on my trunk.
Right, okay. Now, apart from feeling unwell, generally you felt unwell how long ago, would you say?
About a week ago.
Okay, how do you feel now?
A little bit better, but the rash is still there.
Right, okay. Did you take any medications at all?
No, nothing.
Nothing new at all?
No.
Have you felt that you had any pains in your joints?
Yeah, I was struggling to get down the stairs.
Right.
Each joint was really, really sore. I woke up some days thinking I'd slept funny, but it was just my joints really hurting. And they started to swell up a lot.
Right.
My ankles had swollen and my wrist.
Any joints in particular?
My ankles and wrist.
Right. Right, okay. And did you have any problems with eating, or did you feel nauseous or have any diarrhea?
The week when I was ill, I couldn't eat. I was really not hungry at all. And then I had some severe cramps in my stomach.
All right. Have you passed any blood through the back passage at all?
Yeah.
Right, okay. Would you mind if I just had a brief look at your legs? Okay, thank you very much. Right, so we can see a rash on both legs and the feet, and also coming up on the underside, up the legs. Let me just have a look at your arms as well. Could you just put your arms forward for me like that? That's lovely, okay. And you mentioned on your trunk and back. Mm-hmm. Could I ask you just to sit forward, please? Okay. Would you like to just lift your skirt up first, please? For me, please. Thank you very much. Okay. And there's a rash on the back here. All right. I'm just going to have a feel of your legs. Okay. Are they still swollen?
A little on my ankles.
Right. Okay. Now I'm just going to press a glass on the rash. Okay. And we can see that it stays the same, doesn't it? Mm-hmm. All right. Okay, I'll just cover your legs back up. Now, just asking, also, I'd just like to ask about anything in the family at all, any problems in the family with blood disorders, or have you ever been diagnosed with any other medical problems at all?
No, but my granddad has diabetes.
Right, okay. And you don't have any allergies to anything?
No, nothing.
Good, okay. Have you had any problems with headaches at all?
No, I haven't had any headache.
We're going to do some blood tests to make sure that everything is okay. In particular, we look at the kidneys to see how they're working. I would also like to have a sample of urine, if that's all right. At the moment, there's no need to give you any medication for treatment. The rash should settle down by itself. It probably will take a week or so. Sometimes it can last for several weeks before the rash disappears. So do you have any questions you would like to ask me?
I was just wondering if this rash is going to scar me.
It should not, no. There may be a little bit of pigmentation left in some of the scars, but it should settle down.
Right. And when you say that you're taking blood tests and urine samples to check my kidneys, like, what does that mean? Should I be worried about my kidneys?
No, you should not, no. It's just that we like to make sure that the infection that you had hasn't caused any problems anywhere else.
And if it was to, what would that mean?
If we do find anything with regard to your kidneys, then we'll do some more tests and we'll probably give you some steroids. But we'll decide that when we get the results back.
What is your diagnosis?
The non-blanching purpuric rash and its distribution would suggest Henoch Schonlein purpura.
What are the renal consequences of HSP?
Renal disease may develop within 3 months of onset, leading to a glomerulonephritis and a microscopic hematuria. Nephrotic syndrome may occur in up to 50% of patients.
Are there any other features of HSPs?
There may be polyarthralgia, which may involve the large joints, including the knees and ankles. There may be bowel involvement, which may mimic an acute abdomen and involve colic and hemorrhage, as in this case. And of course, renal involvement, which may lead to a nephrotic syndrome and a glomerulonephritis. There are many causes of purpura. These may include vasculitic causes, such as small vessel vasculitis, cryoglobulinemias, Henoch Schonlein purpura, ANCA-positive diseases, connective tissue diseases, and polyarteritis nodosa. Then there are the infective causes, such as acute meningococcal or disseminated gonococcal disease, or bacterial endocarditis. Drugs may also be implicated, such as penicillin or sulfonamides or thiazides. There are other causes which should also be borne in mind, including trauma or steroid-induced purpura, systemic diseases such as coagulation abnormalities or vascular fragility such as Ehlers-Danlos may also result in purpura.